Welcome to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness throughout your journey in life. Your host is Dr. Mohammed Emran, a respected and experienced physician who has treated thousands of patients across the United States over the past 10 years. Listen to Dr. Emran each week as he explains medical topics and life-changing treatments. Thank you for joining me today on Simple Health Radio. I'm your host, Dr. Emran. On today's show, we'll be discussing meningitis. This is a severe infection of the brain and spinal cord. Our legal disclaimer indicates that none of the information provided on this show can be used to diagnose, treat, or manage any health conditions. This show is not a substitute for professional medical advice. Always verify the information that you hear and see your doctor in person or go to the emergency department with any concerns you may have. Meningitis is a life-threatening condition. There are different types of meningitis. Viral causes of meningitis are the most common, but generally are easier to treat with supportive care. Most patients with viral meningitis do not require hospitalizations or extensive treatment. Fungal meningitis is also a special type of meningitis. This is caused by a yeast infection. However, the bacterial causes of meningitis are very serious and many times will lead to death. The early signs of meningitis can be difficult to pinpoint, especially in healthy teenagers or adults. The symptoms may be as simple as high fever, stiff neck, headache, nausea, vomiting, confusion, or seizures. Some patients will develop sensitivity to light. They may stop eating or drinking, or they may develop a skin rash. Very young children have a high risk of meningitis, especially newborns. They may develop abnormal crying, excessive sleepiness, or poor feeding habits. These children require immediate care to diagnose and treat properly. The term meningitis actually refers to the meninges. The meninges are a special type of skin or covering around the brain and the spinal cord. This keeps the rest of the body separate from the brain and the spinal cord. When bacteria cross the meninges, it is called meningitis. The bacteria may develop from something as simple as an ear infection or a sinus infection. Other times it may be from a fracture or a surgery, which leads to meningitis. There are 4 common types of bacteria that we will discuss, which cause meningitis. These include Streptococcus pneumoniae, also called strep or pneumococcus. This is commonly linked with pneumonia, ear infections, or sinus infections. There is a vaccination to prevent this type of infection, or the meningitis, due to strep. Neisseria meningitidis is another type of bacteria. This one is also called meningococcus. This is very common and highly contagious, especially among teenagers and young adults. People who attend high schools, live on college dormitories, or travel to military bases for boot camp are at a high risk of developing meningococcal meningitis. This infection is also preventable with the vaccination, and many colleges and high schools now require this vaccination in the United States. Haemophilus influenza is another type of bacterial meningitis. This is called Hib or HIB. This was previously the #1 cause of bacterial meningitis in young children. The HIB vaccination is routinely given to children and has reduced the incidence of meningitis by over 80%. Listeria monocytogenes is another type of bacterial meningitis. This is actually found in unpasteurized cheese, meat, or other dairy products. This is a very severe infection. Unfortunately, it affects pregnant women, newborn babies, senior citizens, and people with immunocompromised states very easily. This infection will cross the placenta and can lead to miscarriages or abortions. People who develop meningitis will worsen rapidly. Some family members will bring in their loved one to the clinic or urgent care or the emergency department just because of the way they are acting. They may have a high fever, vomiting, or seizures. Without treatment, these people will die. Every year, unfortunately, there are numerous cases of bacterial meningitis among high school students and college students. Many of these people had gone to a clinic in the morning. Perhaps they waited on starting their medication, and by that night, they died. So it's a very rapid onset, rapid progression from the early diagnosis to death. And that's why it's a very devastating illness. People who go to the emergency department will have blood work, lumbar puncture, and immediately begin IV antibiotics. The lumbar puncture is a needle which is placed in the lower back, also called an epidural injection or a spinal tap. The sample that's drawn is then tested to determine if there are bacteria, viruses, or fungus that may be causing the meningitis. A special test called a culture is then performed, and the antibiotics can be matched. However, anyone who has any meningitis signs will receive antibiotics immediately before those results come back. Those patients will be admitted to the hospital for monitoring and are usually kept in the intensive care unit or the ICU with strict isolation precautions. Anyone who is exposed to that person with bacterial meningitis must also be treated. So any family members, classmates, healthcare workers, co-workers who may have been in contact with that person in the last few days or even a week or two before the development of meningitis is treated with an antibiotic injection and antibiotic pills until the threat of the infection has passed. People who are traveling abroad also have a risk of meningitis. There are certain areas in Africa, Asia, and the Middle East which have a very high rate of meningitis. Some countries now have a requirement or proof that is needed to be shown at the airport that you have received the meningitis vaccination. This is kept in what's called a yellow card or the yellow book, which is the International Vaccination Directory. In the United States, there are more than 4,000 cases of bacterial meningitis every year. Over 500 people die due to complications from this infection. If you have any concerns about meningitis, talk to your doctor today, especially if you think you may need the meningitis vaccination for traveling or just to protect you and your loved ones here. Thank you so much for joining me today on today's episode. I look forward to having you soon on my show again.